People who are trying to rediscover their youth realize that their face has lost volume. What happens basically with age is the volume of the face, the fat in the face decreases in size and thereby changes the shape of your face. A normal, youthful face is triangular with the triangle pointing downwards. There's a fullness in the malar area, in the OG line which is here, and the lower part of the face is thinner. But with age, when fat disappears or descends downwards, you see the fat descends downwards, create jowls, the triangle is reversed. Now the triangle faces upwards. To correct this, you have to add some volume to the face. And the best way of doing it is either using a filler or your own fat. These two are very different things, but the aim is the same. So what we do basically, add volume to some area to make it look filler and make your face look younger. The commonest areas are these malar cheeks, the cheekbones. Full malar prominence makes your face look much younger and more attractive, and also aids in getting a better OG curve. Then the hollow below the eyelids on both sides. With age, this hollowness is more prominent, and if you fill it up, the eyes look more youthful, bigger and brighter. The nasolabial folds on both sides, which start appearing with age and become more prominent, can be filled up by putting a filler or fat in these areas to make it less prominent. If your chin is small, you can augment the chin by putting in a filler or fat to make it look better. The jawline can be made prominent by putting in fillers here in the jawline on both sides to pull up the face and make it look more youthful. And of course, if you have hollowness in the temporal areas, the frontal part of the head, these all can be also filled in using a filler. The difference in filler and fat is something which everybody must know. Fillers last for anything between 6 months to 2 years. The thinner the filler, the less is the length of time it lasts. The thicker the filler, the more viscid the filler, the more viscous the filler, it lasts longer. The maximum duration of filler usually lasts will be 2 years, not more. On the other side, if I use fat from your own body, taken from your tummy, your thighs, your hips, or whatever, 50% of fat remains and 50% gets absorbed. But that 50% remains for the rest of your life. And it's good enough, and you can add fat later on after 6 months or more to make it even better. But to put in the fat, you need a good plastic surgeon, a qualified surgeon who knows the way of harvesting the fat, straining the fat, getting the best fat to go in the different layers for it to be getting good blood supply and sustain it for a while. So, if you're looking for rejuvenating your face with some volume depletion to be corrected, the answer is here. You can use a filler, little expensive, short lasting, or your own fat, good plastic surgeon who knows how to do his job, and the rest remains for the rest of your life. Any problems, come to us. We do both of them. We'll tell you what suits you, your face, and of course your budget, and enjoy the results.